We're going to spend the show focusing on some of Georgia's most vulnerable citizens and the state agency working to make a difference in their lives, the Georgia Department of Behavioral Health and Developmental Disabilities, DBHDD. I sat down with the man who heads DBHDD, Commissioner Kevin Tanner. We talked about a range of topics, from ways to boost a workforce that shrank during the pandemic to how the agency is looking to add more beds for people in crisis. But we began with the agency's role in forensic services. DBHDD receives court orders to determine if a person is competent to stand trial or can accept criminal responsibility under an insanity defense.
Under the code, we're responsible for the restoration work. And what that means is if someone's been charged with a crime and their defense attorney or their family or the prosecutor brings to the judge and says, you know, I think that my client may not be competent. They may not be able to help me participate in their criminal defense because of a mental illness, then the judge can sign an order that would require our agency to have a licensed clinical psychologist, a PhD level psychologist, do an evaluation. If after doing that evaluation it's determined that the person is indeed not competent, then the psychologist will make a determination on whether they believe the person's restorable. If they believe the person's restorable, they're saying in their professional medical opinion that the person could be, with treatment, restored to competency. And then typically what happens, that report's given to the judge, to the court, and then the judge will typically issue another order that says, you're ordered to go to the state, to DBHDD, to our agency, to be restored to competency. And once that happens, they go on a wait list and we bring them to one of our hospitals.
And when that happens, you also don't have enough beds for all of that, for everybody who may need that help. Talk about that a little bit.
Yeah, that's one. People often ask me what keeps me up at night in this role, and that's definitely it. And it's because we have almost 800 individuals in jail today waiting on a state hospital bed. And it takes, on average, over a year now for a male to come into the state hospital system once we receive the order. Now, they could have been in jail for some time waiting on the evaluation and then some time waiting on the order, but once we receive it, it's taking a year or more. We only have, in the entire state of Georgia, we only have 641 forensic beds. Now, 60% roughly of those beds have people who have been ordered to us not guilty by reason of insanity. And what that is, that's different than not being competent. That's someone who's been charged with a crime. It's often a serious crime, and the court has made the determination this person's not guilty because they have such a severe illness, such a severe mental illness, they don't know the difference between right and wrong, and they're ordered by the court to come to us. The average length of stay for that population is 6 years. We have people who've been with us for 20 plus years at the state hospital. So I only have about 300 beds in the entire state for restoration services, and I have 800 people waiting on one of those beds.
I want to talk a little bit about your Macon Crisis Stabilization and Diagnostic Center.
That's a project that I'm extremely excited about. It's really getting a lot of national attention. So we are also responsible for the intellectual developmental disability population, and we run the now comp waiver services through the Medicaid waiver program. But we have certain individuals who are what we call hard to place. They end up being stuck in an emergency room. They may have co-occurring IDD, behavioral health illness. They may have a behavioral issue. They may have a physical ailment. But for whatever reason, they end up finding themselves in an emergency room. And we have a challenging time sometimes finding a provider that will take the individual. So we have, I've challenged our team and our staff, and with the support of the General Assembly and the Governor, we've identified some long-term solutions. One of those is the facility that you just mentioned, and it will be a 16-bed inpatient crisis stabilization facility for the IDD population. It will have physical health, mental health, doctors who are experts in treating an individual with IDD. It'll also have things like OBGYN, dermatology, whatever services the individual may need. They'll come there. So they're stuck in an emergency room. We'll bring them to this facility. They'll be stabilized, and then they'll be able to step down into a community-based service. The other thing I'm really excited about at this facility, though, is going to have a very robust outpatient component. And we're contracting with Mercer Medical School, and Mercer Medical School is going to run the outpatient component. And why that's exciting is they're going to bring their docs who are in training through this outpatient center, and they're going to train those doctors. So as they go out in rural parts, especially of the state, they're going to know how to take care of sometimes this challenging population to care for medically. So it's a game changer for our system, and that's fully funded in the budget, and that should open toward the end of May of this year. It's under construction now. The other thing that we identified is we're going to have good places to step those individuals down into community settings. So we've opened 2 pilot homes over in the Augusta area. They're 4 beds each. And we have reduced the number of people in a hospital by over 33% in the last year. We're also in the process of doing 2 additional homes in Macon. And the other thing that is exciting is we sent up a proposal to CMS, which is the federal Medicaid agency, and they've approved 3 types of placements that we haven't had before that's more intense for the hard-to-place individual, and we're in the process of building out that network. So my prediction is in the next 2 years, by the end of the next 2 years, we'll have no one stuck in an emergency room waiting on a bed. We're going to have a system in place to take care of that population.
Quite a large workforce, but I know that there are some vacancies you'd like to see filled by qualified people.
We operate 5 state hospitals, and during COVID we lost over 1,200 employees that left the workforce and went somewhere else for higher pay. Again, thanks to the governor and the General Assembly and some targeted pay increases and some across the board state employee pay increases, we've been able to turn the tide on that. We've brought back a lot of individuals and we also have a department within our agency that's laser focused on recruitment and retention. Theo Carter does a tremendous job leading that effort for us, and it's making a difference. We also have a large number of partnerships that we have forged with universities and technical schools to help turn out folks. I'm going to be having dinner with one of our university presidents here in a couple of weeks, and we're working closely with them to try to create a PhD level psychology program for someone who's actually working in the field. Today, the only way, I have 50 people that work for me who's interested in getting a PhD that have a master level psychology degree. They're master level psychologists. But in order for them to be able to do the evaluations we talked about, to be able to testify as an expert in court, they have to be a PhD level licensed psychologist. I have a 35% vacancy rate in that area. I have 50 people who would love to fill those roles, but in order to get that education in Georgia, they would have to quit their job and go to school full time. So it's been done in some other areas around the state. It's been done in the law enforcement space with the Georgia Law Enforcement Command College. It's been done with public administration and some other areas. So we're having some serious conversations as an agency about how can we partner with the university system to create cohorts and a pathway to help with the workforce. I'm going to be going to one of the medical schools soon to talk to their medical students about number one, consider a field as a psychiatrist, consider going into that. Number two, consider the public sector, consider coming to work for us, consider the state. I tell young people all the time that I've got a staff of over 4,500 employees and a large budget and a lot of stress, and sometimes it can be challenging and frustrating, and because some of the problems are frustrating. But all I have to do is pick a date and go to one of our hospitals, spend time with our staff, our nurses, our doctors, and our patients, and to see the miracles that are being performed within the walls of our hospital every day, where they take an individual who is extremely sick, that has a severe illness, that may be in a place where they're very difficult to even just handle, but get them to a place where they're, and I'm thinking about one in particular where the lady had been in that case, had been on a unit by herself because of how challenging she was. And when I was there, she was out in the courtyard reading a poem she had wrote about her recovery and her journey, and she had hope because she had found the right medication regimen. She had found the right people to help her, to be with her, to walk with her, and for the first time probably in a long time, she had hope restored to her. So if I can get young people to be able to see that side of what we do every day, they get up and go to work every day having miracles, I think we'll be able to turn the tide of our staffing.
Yeah, my final question was going to be what, you came in 2022, so in this period of time, you look back on all you've accomplished, it sounds like you just told me that answer, like the things that make you feel really good about what has happened since you've been commissioner of this department.
Yeah, when Governor Kemp reached out to me and asked me about taking this role, I wasn't seeking the job, I wasn't looking for a job, but I called a person that I have great respect for and asked them what they thought, and they said, Kevin, only a few opportunities will ever come along in your life where you can truly make a difference, and when they come along, you have to take them. And so I took this role because I felt like that we needed to make a difference. And what I have found is we have a dedicated group of men and women across Georgia who are DBHDD who are now feeling empowered to be creative and to create change in the system, and they're performing miracles every day.
The budget passed by the House today calls for more money for DBHD, including to extend forensic services and to add a jail diversion program and outreach services for those with severe mental illness. I want to thank Commissioner Tanner for talking to me.